Hello friends, today I will be giving you an overview about diabetes. Let me tell you beforehand that this talk is basically meant for general public, for lay persons, and I will try to use simple words and not medical jugglery. Diabetes is a metabolic disease. It is basically a disease of pancreas. Pancreas is an organ which is located in the abdomen. Pancreas release insulin. This insulin is released in response to whatever food we eat, and it tries to control the blood sugar. Diabetes is a disorder in which either there is inadequate release of insulin in the body, or because of poor insulin directed mobilization of glucose into the cells. Diabetes is a silent killer, and there are no major symptoms of diabetes. Basically, diabetes is of two types, type 1 and type 2 diabetes. Type 1 diabetes occurs in children. Usually, when the child is of 8, 9 or 10 years of age, during this phase, child develops some viral infection. In response to that viral infection, antibodies are produced, and these antibodies, which are initially produced against that virus, they are misdirected towards pancreas, and in this manner, these antibodies, they destroy the pancreas. Gradually, the whole of the pancreas is destroyed. There is no insulin formation in the pancreas become dead, and the child has to take insulin for controlling blood sugar. Fortunately, in India, type 1 diabetes is relatively less common. Type 2 diabetes is more common in India. It can occur in obese people, that is overweight people, which is the most common type of diabetes. It can also occur in thin and lean persons. Type 2 diabetes can also occur in thin and lean people. Obese type 2 diabetes, that is overweight people having type 2 diabetes, they form the major chunk of patients. Approximately 85 to 95% of patients of diabetes, they are of type 2 diabetes. For medical people, we have other types of diabetes also. For example, gestational diabetes, which occurs for a short duration of time when a female is pregnant. There are other types of diabetes also, which are not important for general public. For an overview of diabetes, it is very important for patients of diabetes to control their blood sugar. The reason being that it is a silent disease, it is a major killer. Initially, there are no symptoms at all, so one tends to neglect diabetes. He thinks that why should I take medicine when I don't have any complaints at all? But the problem is that high blood sugar circulates in the body from head to toe, and it damages each and every cell of the body. For example, when it gets deposited in the blood vessels going to the brain, it can cause stroke. It gets deposited in our eyes. When it gets deposited in the lens, it can cause premature cataract. It can deposited in the retina of the eye and thereby causing diabetic retinopathy. It is a major cause of blindness. Well, it gets deposited in the heart and may produce premature heart disease. It gets deposited in the nerves and thereby producing numbness of hands and feet. I have many patients who are smokers and they have tingling sensation in the arms or hands, and they have total loss of sensation in the hands. Few patients who are smokers, they are just watching TV, holding their cigarette in their hand, and they are so engrossed in watching the program that the cigarette burns their fingers and they are unable to feel the pain. This is the extent of damage to the nerves caused by diabetes. There are people in whom foot gets injured and they don't feel any pain at all. Blood is coming out of feet and they don't feel any pain at all. And there are many people who have to undergo amputation. So my dear friends, my message to you is that take diabetes seriously, consult your doctor. It is important to pay regular visits to your doctor for control of diabetes, and by any means control your blood sugar so that complications which occur in 10, 12 or 15 years after the onset of diabetes, they do not occur. Thank you so much.